Hi, everyone. I'm Samira Daswani, the host of the podcast, The Patient from Hell. It is my complete pleasure to have Alex Drane here with us. Alex and I have been talking about doing this episode for months, maybe a year, maybe months. We'll go with
I think
months.
a year.
A year. Okay, we're going with a year. Alex Drane is a true force of nature. I cannot wait for you guys to hear her story, hear the many incredible things that she has done in her life and is doing today. So, with that introduction, hi, Alex. Welcome to our
Hi, all
show.
the respect and love back to you. And I think, you could call it the patient from hell, the caregiver reality from hell. Why did it take you and I a year? Because we both care so fiercely about what we're doing. And there's a lot to be done in the areas that we're working in. So I'm so grateful we've made it work. Fantastic.
All right, Alex, I actually want to start not with caregiving. I want to start with I read this thing about your bio that I would love for us to go into if that is true, which
We can
is you
go
work
anywhere you want.
done. Okay. Is it true that you work part time as a cashier at Walmart?
So for 18 months,
Uh-huh.
and that 18 months ended about 4.5 years ago. And for a good long while, I was still on the payroll, on hold, so I could go back. I have not gone back to my cashier job. I did get promoted to customer service. Walmart store 2660. Shout out to all the peeps at North Reading Walmart. Love my store. Loved that entire experience. Yes, I was a cashier in Walmart. Yes, I was. Loved it.
Alex, how did you end up at Walmart? And then how did you go from Walmart to where you are today?
So, it's one of those things that I get now why that seems so crazy to other people, but we're all in an arc, right? We're all in a trajectory. And for me, where I was in my life right there was 100% the only and best place to be. And it has since been transformative for me. So I had recently left the company that I had been working to build with a team of extraordinary people for about 15 years and had taken a stab at what we call Archangels Take One, and it had been an abysmal failure.
Hmm.
And it was a time in the world where there was a lot of talk from people about the social determinants and reaching out to broader communities. And I was hearing all this talk. I myself was traveling the country and giving talks. I wasn't seeing a lot of action. And I felt like there was this enormous disconnect between what we said in reports and what we talked about. And we, meaning people who were supposedly informed about and intentional about putting our body there and supporting a broader population and a broader definition of what health is. But then one day I was like, well, you're kind of full of crap because what do you actually know? Right? Like you've worked in corporate environments and you have had a lot of things be easy for you.
Yeah.
And I felt the need to get out of my bubble. I felt like I lived in a bubble. And I talked to a lot of folks and they said, well, you should go volunteer. And I said, I don't want to volunteer.
Yeah.
I want to be in a community, part of a community authentically.
Yeah.
And so I thought about different places to work, and I have had a big crush on Walmart for many years. And a friend of mine was an executive there at the time, Marcus Osborne. And so I was like, you know what? I'm going to be a cashier at Walmart. I don't know how to do that. So I called Marcus and I was like, hey, Marcus, I feel like I live in a bubble. Can you get me a job? I don't even think I said, can you? I said, get me a job as a cashier at Walmart. And there was this long pause, and anyone who knows Marcus will appreciate this long pause. And then he started crying with laughter. And he was like, did you hear yourself? I was like, yeah, come on, get me a job as a cashier at Walmart. There's one in North Reading. That's where I want to work. And he said, you just said, I live in a bubble. I need to get out of my bubble. So, hey, Walmart executive, get me a job at Walmart. He said, get your own effing job. And he hung up.
Oh,
And
that's
I,
so
yeah.
good.
And I remember sitting there in my
That's so good.
beautiful, my home office, because I was lucky, and being like, I don't know how to do that. And it took me about 10 days to work up really the courage to like go online and apply for the job. And that began one of the most extraordinary 18 months of my life.
Wow.
Yeah. I don't know how many of you who are listening have done things besides just going through whatever you're going through, which probably has taken you outside of your comfort zone multiple times. But I will tell you the first day after getting hired, which is a story in and of itself, and serving my first shift, and then it was time for lunch. and standing at the door of the break room and like didn't know anybody. You were the new person. Like, where do you sit? You know, I was 47 at the time. Like,
Wow.
I was so scared. I was like a terrified 8-year old. Like, where do I go? What do I do? Most of the folks there were literally and figuratively not speaking my language. And it was good. I think we have to all put ourselves in places where we are raw and exposed and terrified and work through them.
Hmm.
And that is where tons of learning and compassion comes from.
So here's what I have to do for our listeners. To put this in context, Alex Drane has started what, three companies? Third
I
company?
am on my fifth.
Fifth company, five companies. She is a rocking female entrepreneur, changing the landscape for caregiving. And she took 18 months of her life to go to work as a cashier in Walmart.
Yeah.
I
And I
truly
loved it.
believe, and she loved it. And I think there's something really powerful in that story, though. I think, of course, the putting yourself outside your comfort zone, but for those of us who work in healthcare and who have privilege on our side, when we are working to design things for people who may not have the same level of privilege or have different privileges than we do, I think your experience in that moment is almost a necessary thing that we need to be doing.
I love that you just said privilege and then you caveated with different privileges. It's one of the reasons why I love you, right? You always come with this broader lens of a broader sense of what are we all doing and what is humanity and who's doing what where. Different privileges is a really, really important thing. I will tell you, I came to feel over the course of that 18 months that there are obvious privileges that I have that you have, right? Like when this happened, I was working at my home office and I had the ability to work from a home office. And there are a lot of things that I don't have to worry about that a lot of my friends did not take for granted the way that I am lucky enough to be able to too. Um, there were other things that were so gorgeous and strong about this population of humans with whom I was so lucky to spend a good amount of time. That that I am in awe of the strength of community and the power of people and just the raw intelligence. I think one of the things that the 1%, 5%, 10%, whatever percent do is they underestimate sometimes. Some people underestimate
Yes.
how crazy smart the vast, vast, vast majority of the
Yes.
world is.
Mhm.
And people might be making decisions because we can't see into why they're doing it. But make no
Yes.
mistake about it, it's an intentional, informed, data driven decision coming from a different set of facts, different set of circumstances. But I am, you know,
Yes.
these managers who are running Walmarts, they're running multi-million dollar businesses. And these gorgeous associates and folks who are working all up and down that organization, they are running numbers in their head. They are salespeople. They are relationship managers. They are merchandisers. The work that people are doing is incredibly impressive on every level.
Alex, there was something you just said that I have to underscore, maybe from a different lens, which is I think very often in life we dismiss parts of our population and our community because there is an implicit and sometimes explicit societal structure. And one of the things that plays out, at least, and I'm sure we'll get to this on the caregiving side, but at least in the work that I'm doing right now, we see this all the time in the patient doctor interactions. Unless you're a patient that shows up, like the name of this podcast, as the patient from hell, sometimes you are dismissed. Not always, but sometimes. Unfortunately, I would say it's often enough because as patients, we're discounted because it is assumed that we don't know medicine, we don't know the terminology, we don't know how to navigate healthcare. And I think that is largely true. But the thing that really gets under my skin is when we assume that someone, when they're facing a mortality based diagnosis and they're facing essentially death in the face, that they will not go to every single conceivable limit that they can possibly go to get smart.
Yeah.
I've seen so many individuals, Alex, and this is true from my time in India, of course, in the US. I've seen people who don't speak English, who have not had a high school education, get so smart about their type of cancer that they are in PubMed reading abstracts and sometimes have read more papers than their treating clinicians.
Oh yeah.
And
Well, and
that's common.
it's
And
so
that's the
common.
amazing part.
Necessity is the mother of invention. And the healthcare system has taken often a very traditional clinical view for how to solve whatever your condition is.
Yes.
And I think one of the beautiful things about taking a broader lens of what your condition is and who might be smart about it, one of my favorite people in the world is Susanna Fox. Do you know Susanna Fox? Do you need to know Susanna? Everyone needs to know Susanna. And she does a lot of work in the peer to peer space and talks a lot about especially patients, humans who are in these situations where the traditional healthcare system is not offering a solution. They become genius, mad inventors. And if you can look condition by condition, whether it be childhood diabetes to allergies, life threatening allergies, to every type of cancer, every type of heart condition, there will be someone not 2 to 3 steps removed who has in their basement, in their church, in their YMCA, jury rigged something together that is solving a previously ununderstood thing or believed it was not, you couldn't do it, this treatment couldn't happen, and they figured it out. There is genius everywhere. And part of what we as an activist society need to do is, and she's writing a book about this right now, actually, is sort of like tap into that expertise, tap into that innovation, tap into that genius, and
Yeah.
pull it right into the mainstream. So these gorgeous genius folks who are not only sidelined and ignored, but to your point, often protested against by the traditional healthcare system, by doctors being like, that's silly, that makes no sense. And let's be clear, you and I both love a lot of doctors. There are a lot of doctors that are fantastic. And by
Yes.
the way, doctors are exhausted and they're stressed, and nurses, and the whole healthcare system is.
Absolutely.
And it is also true that if we did a better job tapping into the expertise and mother frickin' genius of the humans who are experiencing this stuff firsthand all day, every day, they're solving problems that we could incorporate into what we're doing. And we would immediately take a giant step forward in the delivery of care.
Here, here. You should be hosting this podcast. I'm
We could do,
totally
I mean,
serious.
we could literally, like, you should have a whole side podcast finding these geniuses and having them talk about the inventions that they've come up with and making them accessible to the rest of the population.
It's a very good idea. I mean, you're completely right. We have this like crazy statistic that goes around internally at Mantacare is that on average, this is average, patients and families going through cancer have at least 15 DIY tools they have come up with.
Yes. Yes.
You have to.
You
There
have
are
to.
no, there's, I mean, what's the alternative? There is no alternative.
Yeah.
You come up
Well,
with whatever you need, right? Be that
whatever you need.
thing or.
Yeah. And by extension, the people who are loving you through it and with you in it, they have their own hacks. And
Oh,
we're all hacking our way through this. And the thing that, the sad, I could say it negatively, the thing that makes me sad, the positive is the thing that makes me feel hopeful and fierce, is increasingly as the level of intensity and level of frustration and level of disregard for humanity is increasing, people are
yes.
stepping up and taking different levels of action, forming weird little groups of expertise, finding each other, whatever crick and crack that they can, and coming up with ingenious ways to solve things. And I do hope as a society we can take more advantage of that and shed more light on those stories.
So, Alex, I'm going to use that as a sort of slight pivot on the conversation, which is one of the things I distinctly remember about our first conversation was you've built many companies, but you are also not building companies in the way, well, at least Silicon Valley builds companies. I'd love for you to talk about that. So
Yeah.
why the different model? Why not take venture funding? What is it about Alex Drane's method of building companies that makes it really successful? But there is something there. I'd love to tease it apart.
It's so funny. The thing that's interesting is you and I like fangirl you all the time. So thank you for saying Alex Drane's way of building companies. That's because you're kind. What I would say is it's actually, for the vast majority of the history of the universe, the way you build a company is not by raising money. It's by getting started.
Yep.
And I love the saying, the best investor is revenue. And what's really interesting for the types of problems that we try and solve in the companies that I've been part of and the types of organizations that we build is they're weird and they're not mainstream. And often they
Yeah.
surprise the
Yes.
more traditional guard who are like, well, that's weird and that's not going to work and nobody cares. And we're like, well, I don't know. I think it might.
Mhm.
And I would also say one of the reasons for me, from a safety perspective, I think I've never raised VC. Um, I think I have a little bit of arrogance. I think many entrepreneurs do, probably more arrogance than I would like to admit. And I often think, I'll speak for myself. I'm not going to speak for the team because they'd be mad at me. I often think I'm right. And we have an idea. We're like, this is going to be genius. This is going to save the world. This is what every unpaid caregiver needs. Bam, done. We're going to get the Nobel Peace Prize. And we build this thing, always with limited scrappy ability, piecing things together because we are bootstrapped, which
Yeah.
keeps you incredibly innovative.
Yep.
And then the thing that we built fails miserably, fails in completely unpredictable ways. And because we have no money, we can't lie to ourselves and pretend and torture the data until it confesses and say, oh, it actually does work. It works in this little tiny way. We're like, no, that was a fail.
Yeah.
All right, what did we learn? Let's go back to the drawing board. Maybe 20% of it was right.
Yeah.
Freaking awesome. 20% is a win. Let's get started on 80%. And so we just hack, grit, determination, nonstop. And it's always based on real life feedback from real life people, from real life environments that are not, somehow tortured or twisted into creating a perfect environment.
Yes.
It's why stage 4 drug testing is such an important
Right.
thing, and taking it out of the clinical trial and into the real world. We often find that drugs don't work the way that we think once you stop delivering something in a perfectly controlled atmosphere. So
Yeah.
we like to start in the wild, uncontrolled world.
Yeah.
And if we can make even a bit of something work there, we know that as we get into more privilege and more control and more this, and that, we're going to nail it. And so we start from the, outside in, bottom up, top down, back in, however you want to describe it. We go to the weird places first.
Okay, so here's why I said Alex Drane's method of building companies. So let's just put this in context, okay? I grew up, my family entrepreneurs in the sort of small business universe of entrepreneurs. My parents were my grandparents, both sides were refugees from Pakistan and India. So we started from scratch. The family started with nothing. Parents started with nothing, right? So it's ground up small business. So I've grown up in that environment, right? But small business and what you're describing are not the same thing.
Yes.
They're not, because what you're describing is going after the really, really hard problems. So the thing that I love about your method is you're going after the really hard problems, which is very hard to do if you're using a small business approach to building companies. So it's almost like you're building venture companies, but not using the venture method. And I think that's really, really remarkable. And I do think it's a different thing. So
Well,
I'm
so
not
here's, I
dismissing.
think, yes and no. Yes and no.
I'm ready.
Right? I always take notes while I'm thinking, I'm like drawing little diagrams. The way that it's not the same thing is that I personally, again, I'll always speak for myself, am fiercely competitive and wildly impatient. So let's take as an analogy a small business. Let's say we had a little bodega or we had like a little clinic.
Yeah.
The second something started to work, I would want to scale that. So what drives the way Archangels build things, or that Eliza built things, is we believe in being scalable and sustainable. And what you're doing needs to be self-sustaining, right? And again, sometimes venture robs you of the ability to see what would actually be scalable or sustainable. However, where I think we're very similar to the companies I might suspect that your family has built over the years is if you're not building something very close to the community when you start, deeply embedded in the real way people think and live, then
Yes.
you're going to have missed the mark. So one of my favorite Walmart store managers,
Hmm.
I said, all right, his name was Roma, tell me, what makes the difference between a really successful Walmart and one that is not successful? And probably most people listening will presume it's oh, you got to have the best merchandiser. You need an analytical animal. You need somebody who knows, trend spotter. No, you know what Roma said? The very best performing Walmarts are run by somebody who cares deeply and knows intimately every detail of their associates' lives. Because what matters the most to that store running well is the workers who are there caring and showing up every day. And if someone's just been kicked out of their house or gotten a divorce or a child has a really hard diagnosis or mom just, moved in and she's got dementia, the list goes on of the things we all live with every day, that's going to impede their ability to show up well at work. And that wasn't, and he was answering analytically, and he was also answering because he really genuinely cares, because employees can smell on you if you're just trying to get the most work out of them. And so the small business mindset is, I will know everything about the people who are here, and I'm going to care on them. I'm going to love on them. I'm going to get them what they need to do their job. And if I care for them and I take care of them, they will take care of the rest. And so I think it's the merging of small business mindset meets must be scalable and sustainable. And so figuring out what of what we just did could we scale in a sustainable way.
I I love that so much. I absolutely love that.
So let's go back to your family and let's take one of these businesses and freaking scale it. I'm in.
Done. We'll have to move to India though.
Yeah. And then we'll have our other podcast on the side. Like,
Done.
see, we've already got two things, two side businesses we're spinning off right now.
Done. This is what happens. This happened the last time too. I'm pretty
This
sure.
happened the last time. Exactly right.
Oh, that's awesome. Okay, so I think that brings us to, there's a diagram behind you that I think you may have to talk about a little bit.
Yeah.
Can you talk to us about what that is?
Yeah. So I'll show you. I don't know how much of it you can see. Where it starts there, ends there. So I gave a talk. Maybe it was 2015, and it was clearly before COVID, and back when it was like 4,000 people in the audience, and they would hire these incredibly talented, as evidenced by what's behind me, folks to draw out what the keynote speaker was saying. And so what you're really looking at is a pictorial, an incredibly gifted pictorial representation of the talk that I gave, which really documented our sort of discovery. I will not say invention, because we didn't invent it. It was the discovery of what we called the unmentionables, which is this idea that the biggest diseases in the US were not at that time actually only diabetes, cardiovascular disease, respiratory conditions, cancer, but actually this broader definition of when life goes wrong, health goes wrong. Yeah. And that maybe caregiver stress, financial stress, relationship stress, and workplace stress were actually the biggest things we should be focusing on. And that life, we need to organize more around Maslow's hierarchy. And this idea that for every single human, first and foremost, we need to make sure the basics, the bottom of that platform, right? Safety, security, transportation, food, obviously housing. Then I think there's this idea, and I do worry sometimes with the social determinants, not everyone's interpretation of it. For enough people, like, oh, you have a house, you have food, okay, you're good. Like, no. Because between that and the highest order of achieving your finest self is caregiver stress, financial stress, relationship stress, and workplace stress. And so we've got to, and again, this was not our being smart. We sat on a technology platform that had a patent to doing outbound calling using speech recognition. So we, over the time that I was at Eliza, we gathered over 1 billion data points.
Wow.
By having these extraordinary interactions with humans that were giving people a chance to talk about what was actually going on. So our job, we were getting paid to like remind someone to get their mammogram or go get a colon cancer screening. Wow. And what we would hear back from somebody, if they said, this was an automated platform, but deeply personal and human, if they said they couldn't get it, we learned to ask the question, why? It wouldn't be what we would have expected. It would be like, well, my mother with Alzheimer's just moved in, or I'm pretty sure my partner's cheating, or, I hate my boss so much I can't breathe. And we learned that those, if you bucketed those things together, those were what we called the unmentionables. And so this was our path from, let's take traditional clinical approaches to get more people into the doctor to be diagnosed and have clinical regimens following care pathways as defined by, to let's actually get someone a job. Let's help them save their marriage. Let's make sure their kids are all right, and feeling safe at school, that maybe that is the first and most important definition of what health is and how to support it.
Oh my god, this is so spectacular. I actually can't remember if we ever spoke about this, but my master's thesis was on caregiver burnout. But not caregiver as in like family caregiver, but more like clinicians and doctors and nurses and MAs and PAs and the true frontline workforce. This was pre-pandemic, so
Yeah.
this was all of our research is kind of truly probably minor compared to kind of what's happened since we did that work. But what you are just describing was true even in that workforce.
Yeah. Well, it's funny. I mean, you had said something earlier about the sometimes we're dismissed, and I was thinking in my head as you were talking about that, and just how difficult it is to be a patient, to be a human in the system,
Yes,
when the system's not equipped to really think about you as a human.
yes,
And the thing that I think has happened for doctors and nurses and techs and every beautiful soul out there on that front line is, as the definition of what it means to deliver care has changed, the notion of moral injury and moral despair, and being, which you could describe way better than I could, has created such a crisis with these beautiful souls who have thought that they were putting their body there to help people be healthy and live longer and live well, to be
yes,
like, I'm being asked to do stuff that is morally incomprehensible and I can't do it. It's making me physically ill.
yes,
And so thank you for what you did with your work. And I actually would say, you're probably a part of why this is now something that's in the vernacular. And we work, for example, with what we call double duty caregivers, those folks who are, serving on that front line in a healthcare job or in any capacity. And then who are also disproportionately the ones who are going home and caring for friends, family, neighbors, loved ones, you name it. And they're the front line for them as well.
yes. I think that's completely true. Alex, what you described was completely true. I think there were two pieces that were when we were looking at this somewhat surprising. One is it did I think post pandemic really did shine a light on the whole piece of it in terms of frontline workers and their lives. But I think pre pandemic it was this quiet thing that no one spoke about.
Yeah.
I mean, the numbers pre pandemic were 42% of clinicians are burnt out. This was pre pandemic. This was not, it's 2018, 2019, 2017. Like you're talking years before the pandemic, right? And we were talking about 1 in 2 clinicians is burnt out. And if you look at the rates of depression, anxiety, suicide, the profession of healthcare is one of the highest. It ranks one of the highest on some of our worst mental health problems. And when I got diagnosed as a patient, I just remember sitting there feeling really paralyzed because I unfortunately knew all this data.
Yeah.
And I'm sitting there going, I'm not being treated as a human, but the irony is neither is my doc.
Yeah.
Neither is my doc.
Yeah.
Neither is my doc. And the thing is, because neither is my doc, you're sitting there going, okay, I, as a patient, I'm being dismissed, but I can't imagine that the doctor can do more than they are. And I think it's that moment of like paralysis almost. Because then it's you're sitting there going, okay, if the doc is paralyzed, I'm paralyzed, who in the world is driving this care?
Yes. I I know you run your company, and I know you've had this feeling before. You're reminding me of as the person ultimately responsible, everyone comes to you with their problems. And I often at the end of the day, I'm like, I need to get on someone's lap. Whose lap do I get on? Right? Like I need someone to rock me.
Yes,
And
yes,
when you've got a patient and a doctor, and both of them are sitting there like, I don't know what the F is going on. And this system is effing me up too. And I'm exhausted and I'm tired. I'm terrified. And I'm going home to a family that's mad at me. And, you know, where do you go? Like, whose
yes,
lap do you get on?
yes,
And I just think what is beautiful about the way you describe it is what I think is necessary for us to get out of this space, which is to see that that is true and to start from the place that you just started of having empathy, which is people aren't doing a bad job or not the job that you want them to do because they're evil or mean or dumb or bad or lazy or stupid. Quite the opposite.
yes,
Humans are, every place that I've seen them. Yeah, there are a couple people who might be a jerk and they're probably having chronic pain. or their partner just left them, or who knows what. But for the vast majority, humans are bringing their best selves.
Yes.
And when the system is set up to completely confound even the best intentions and lead to very, very sometimes, unfortunately, often bad outcomes,
Yes.
it creates learned helplessness. And I worry that a not insignificant part of our healthcare system has learned helplessness.
That's I am so yes. I have nothing but a resonance to what you just said. I really do think it's learned helplessness. And it almost requires it's almost like the setup that requires a patient to show up as a patient from hell. It's actually
Yes.
not that you're against the doc. It's that because the system is just not set up to enable you to navigate the system, that the only way to shake someone out of learned helplessness is to literally shake them out of learned helplessness, because
Yeah.
otherwise the problem is the burden then shifts back on the patient,
Yeah.
which is just this like funny seesaw that happens, right? It's a
Well,
seesaw
and
going.
it's what you just said. It's like you either shake them out of it or you become the patient from hell. You become an activist. You become a revolutionary.
Yes.
And, I do think we as a nation, the notion revolution, people are like, well, you're crazy. Like, I don't necessarily mean revolution the way people think of. I mean, people are going to eventually, like, what is quiet quitting? That's a revolution. That's people saying, I'm running the numbers and this doesn't make sense for me.
Yes.
Right? Why are people turning down some treatments? Because they're like, I'm looking at how much money that costs and what you're telling me it's going to do and how it makes me feel and how I'm showing up at home. And I'm not going to do that. I'm intelligently making a decision to say no. The other thing that you just said is, I do believe when you talk about, you know, not being against the doc and this notion of it, my sister, and you know this, my sister's beautiful, beautiful, beautiful 32-year-old diagnosed with glioblastoma the night that I got hitched to her brother and died 7 months later in a terrible case of overtreatment, textbook case. And over the course of those 7 months, my man is Sicilian. And in his part of Sicilian culture, the doctor is God and you don't question
Yes.
God. And you don't talk about death or the fact that you're dying because that hastens death or dying. So here we are. We've just gotten hitched. I know what glioblastoma is. I figured it. I didn't know at the time, but I figured it out really quickly. And we were supposed to be flying off on our honeymoon, and instead I'm like in the this incredible room in this hospital in Boston, and Antonio's at the bedside of his sister, who was only speaking in Italian because the tumor had grown to such a place that's how part of how it suddenly all triggered. And I walked out to the doctor who was looking at the screen because you always know someone knows. And I said, "What are you looking at?" And he said, "I think it's It is glioblastoma, and I think it's stage 4." And I immediately went to go walk down the hall. It was this beautiful sunlit hall, and I called my mom and I was like, "Mom, you got to Google glioblastoma stage 4. What is that?" And she typed, and then she was so quiet, and she said, "You need to sit down." And she told me, and what she told me is, most likely she will not live a year. And if she lives 5, it'll be that she has broken every expectation. And I remember walking back to that room, I get chills, where there was Antonio sitting at the bedside of his sister. And I knew I could not tell him that. And over the course of that next 7 months, what happened was this dynamic where I work in healthcare and I know how often medical errors happen with the best of intentions. And so we would go into a doctor appointment, Antonio, Za, myself, Za's man, and I would be very aggressive. Why are you doing this medication? Tell me what the protocol is next. Why would you think this would work versus this work? And Antonio would be embarrassed. He'd be like, you have to stop. You're embarrassing. Stop talking. Like literally, very respectfully, he would say to me, please, you're embarrassing me. You're embarrassing my mother. And it wasn't until the very end where, because we did all these things to get different types of care and it still failed. And the very, very, very head doctor came in the room and said, I think we're there. I think Za does not have a lot of time left. What do you want to do? And we said, we want to take her home. And he said, oh, well, you can't take her home. You can't take her home. Her case is way too complicated. She's going to have to stay here. Mind you, she had a 2.5-year-old girl baby at the time.
Oh.
And that was the first time I saw my man become the patient that you're describing. And it was the first time I actually sat down and got quiet because I was like, oh, well, I guess I don't know, I'm outside of my limits. And he stood up and he said, abso-freaking-lutely not. We are taking her home. We are going to do what we need to do. She is coming home right now. And so you see people reach the end of their ropes against this learned helplessness. And he finally, and I'd been like combating the way that I could, but I'm not the brother, right? I don't, and it was beautiful to see. And I think this is my long-winded way of saying, I think we're getting to a place where more and more people are going to stand up
Yes.
and say, I'm taking matters into my own hands
Yes.
because I can't see my mom continue to be tortured, my sister, my husband, my partner, my brother, my neighbor, my lover, my daughter. I say no, and we're going to make different choices. And that learned helplessness has reached the end on some level.
Alex, I almost have nothing to say to that, because what you just described is honestly the thesis behind the work we do. It is the foundation of the work we do, because I think that your story, the experience of you, your husband, Zaha, is, as unfortunately, I think, the story for a lot of people.
Yeah. Yeah.
That is the story for a lot of people. It's the story that we went through. Like I got treated during COVID, so I'd show up for these appointments alone, and my family would be like, "Can you just calm down? Can you just?" I was like, "Y'all don't understand. If I don't show up in that way, I know, I know we're gonna make mistakes." And it's not, again, it's not intention. It's the doctors doing everything in their power. They're on your side. They're trying to
Yes.
get me the best care. But it's almost like we're speaking two different languages.
Yeah.
And the mistakes are happening because we're speaking two different languages. And it's mistakes in translation. And I did show up that way for not all my appointments, thankfully. And then finally my doc and I learned a way to, like, she'd walk in, she'd see my face, she's like, okay, all right, we gotta do this appointment differently. So
Yeah.
we got to an understanding, but it took learning on each of our parts. And it was one of the most challenging but one of the most remarkable experiences, because you do learn to communicate in a different way. I just,
Yeah. To advocate,
yeah,
right?
absolutely.
And I'm guessing for your doctor, you were a bright spot for her always, because to your point, your ever empathetic approach to seeing that's not how she wanted to practice, right? But that's where many doctors have been put into that situation.
Yes.
And what a joy to walk into a room where somebody is showing up with intention, with knowledge, a forethought, to be like, this is what I want to do, this is why I want to do it, this is, what do you think about this, what do you think about that? um, and I do think we're seeing more and more doctors saying, I need to be part of a system that lets me practice the way that I want to. And I need to find a way to make that work economically, because yeah, like, I need to feed my family at the same time. What alternative structure exists to let me be able to have integrity, to whatever, humane, whatever word you want to call it, to be loving, to care for the small things, which we know in the end are actually the big things, and to listen hard to what my patient is saying and what they're not saying,
Yes.
so I can ask that follow-up question, because I got the time and it's going to be okay that I do.
Alex, that's such a beautiful place. I'm watching the clock, and I think we sadly will need to wrap up. But there's something you just said, something that I think almost, in a really funny way, captures a lot of what we spoke about, which is, it's the small things that matter. It's actually not the big things. It's the small things. It's the community that matters. You need to build companies that are small, that have that family orientation, the community orientation in there, to really get to a point where we build things of meaning and communities of meaning.
Yes.
I think the small things comes up in that moment where your partner gets up at the end and like decides that that's the line that will not get crossed, and you remember that so many years later.
I get chills right now.
I
It was 19 last week, it was 19 years ago exactly. And it is like I am there watching him, and it was like, it was so beautiful. It's I love that notion of, can we take the small things be in them with intention, love through them in very earnest, authentic ways, and then scale that.
Yes. Yes.
Scale that, right? And I believe that we can. And I think the healthcare system, which, let's be clear, the healthcare system is nothing other than the fabric of society. The
Correct.
healthcare system is our lives, right? How we care for each other and get cared for
Absolutely.
ourselves is not a system. It is humanity.
Yes.
And I think we need to go back to what matters, who are we, how do we show up for each other, how do we lead with love? And guess what? When you do that, you can be sustainable and scalable. You really can. So it gives me, I love to listen to you and what you're doing, because I do believe in the end, I have enormous hope that and faith that we are all stumbling around in the dark, groping, trying to figure it out. But I think we are getting there.
I definitely agree. Alex, thank you for showing up today, and thank you for sharing your story. I have chills right now. Just
I
hearing
just
you talk.
I love that you and I
Fantastic.
had literally, like, we could have 17,000 other
Yes,
conversations.
very easily.
And I love that, as somebody who cares so much about caregivers, the perspective that you take and you bring and that you have
Thank you.
is so important to that unpaid caregiver. So thank you.
Thank you, Alex.
And yeah, I'm looking forward to a world where we get more voices like this out and heard. And because there's a lot of people who can't wait to hear something like this and go put their bodies someplace different.
Thank you for everything you do, Alex. Really.
Thank you.
This podcast, show notes, and newsletter is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or any materials linked from this blog is at the user's own risk. The content here is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions.